Today's video is about gonorrhea. I think that this is something that has a lot of stigma and taboo attached to it, which it really shouldn't, but it does. But I'm not talking about it as a disease today, but more about the fact that in the last 48 hours or so, 2 new antibiotics were approved to treat gonorrhea. And we've always had antibiotics to treat gonorrhea. And as I've talked about in prior videos, antibiotic resistance is a major issue. And what was happening is we were getting completely drug-resistant strains of gonorrhea, which were very difficult to treat. And sometimes no treatment options were available. So this was an urgent threat to try and reduce it. It was an urgent threat, but didn't get much attention because it's a sexually transmitted infection and there's all that stigma and taboo. So now there are 2 different drugs that can be used kind of as antibiotics of last resort, and maybe even up front in certain cases, because one of them is a single dose that can be given orally, that really kind of show that when you have a concerted effort to develop new antibiotics, you can succeed, because we've been in a situation of bad bugs, no drugs for some time. A little bit about gonorrhea to keep in mind, it's underdiagnosed, cases are going up. Some people may have no symptoms at all. You can have gonorrhea in the genital area as well as in the mouth. It's something that is able to disseminate through your body in certain individuals. Immunocompromised people may have more severe cases of it, and it travels with other infections as well. So the fact that we have 2 new drugs for drug-resistant gonorrhea is a major, major advance. And I think hopefully this will help turn the tide against drug resistance, but these drugs, have to be used judiciously. And the thing is, antibiotic resistance is a fact of life. There will be evolution of resistance to these antibiotics, but I think we've bought ourselves some time. But in general, we need more investment in antibiotics because the pipeline, even though we've gotten some new drugs out of it, isn't that robust.